Good morning everyone, myself Ms. Sanjana. I am Ms. Idra. So today we are here to demonstrate coughing and breathing exercises. Coughing and breathing exercises are the powerful tools, helps to clear the mucus and improve lung function and support the recovery from respiratory conditions like asthma, bronchitis and post-operative surgeries. Coughing exercises will be demonstrated by Ms. Idra. Coughing exercises is helps to clear the mucus and improve the lung function and clear the mucus secretion from lungs. It have four exercises: huff coughing, control coughing, staged coughing, and deep coughing. Now I request standardized patient Miss Sanjana. Can you sit please comfortably and follow my instruction? First huff coughing. Take deep breath. Hold 2 seconds and exhale. Ha ha ha. It is a gentle and controlled coughing. It clears the mucus without straining. In this exercise, we used techniques like inhale deeply, hold 2 seconds, and exhale forcefully, saying ah ha ha ha. It is used for the patients who are asthma, COPD, and post surgery. The next exercise is control cupping. In this exercise, we follow the techniques are sit upright, inhale deeply, and cuff twice. First cuff is loosen the mucus. Second cuff is expel the mucus. This exercise used for the patients are elderly and post-operative patients. Now I request Ms. Sanjana do the exercise. Take deep breath. Cuff twice, repeat it 2 times. The third exercise is deep cuffing. In this exercise, we use the techniques are breathe deeply, hold and cuff forcefully from belly. This is used for pneumonia patient and bronchitis patient. Take deep breath, hold it, cuff forcefully from belly. Try to 2 times. The last exercise is staged cuffing. In this exercise, we use techniques are cuff rest, repeat in stages. This used for weak patient and post-stroke patient. Now I request Miss Sanjana to do this exercise. Cuff and rest alternative. Whenever we teach the cupping exercise, we should keep the articles like sputum cup, we collect the sputum, face towel to wipe the face, and gauze piece to wipe the sputum outside of the sputum cup and keep in the kidney tray. This is all about articles. Thank you, Miss Sanjana, for being my standardized patient of this demonstration of cupping exercise.